The body skeleton is divided into axial skeleton and appendicular skeleton. The body skeleton is divided to axial and appendicular. Axial skeleton composed of axial skeleton composed of skull, vertebra, and skull, vertebra, and ribs. Okay? Axial skeleton consists of skull, vertebral column, and ribs. Appendicular skeleton consists of upper and lower limbs. Upper and lower limbs. Okay? Body skeleton of the upper limb consists of 32 bones. 32 bones. These bones are clavicle, scapula, humerus, ulna, radius, 8 carpal bones, 5 metacarpal bones, and 14 phalanges. Yes. Clavicula and scapula forms shoulder-girdle. Clavicula and scapula form shoulder-girdle for transfers of the weight of the upper limb to axial skeleton. This girdle consists of 3 joints. This girdle consists of 3 joints. 1, sternoclavicular, 2, acromioclavicular, 3, gelenohumeral or shoulder joint. Gelenohumeral or shoulder joint. Okay. Clavicle. Is a border between trunk and neck. Okay? In all lengths is touchable. From medial to lateral, you can touch clavicle. Okay? Medial end joined to sternum, or this is called sternal end. Lateral end joined to acromion, for this is called acromion end. So, clavicula has a medial and lateral end, superior and inferior surface. Superior and inferior surface. Superior surface, inferior surface. Okay? Medial end is larger and you can touch it. But the lateral end is flat and is not touchable. Okay? Medial end, you must use fingers. From today, as a doctor, you must use fingers for evaluation. For this reason, for this time, you touch clavicle. The start of your course is touch of clavicle. Touch of clavicle. Touch, yes. touch of clavicle from medial end to lateral end. Okay? Medial end is touchable very easy, but the lateral is difficult because the medial end is quadrangular, lateral end is flat. Okay. Superior surface has not a special feature, but inferior surface, you can touch this groove. You can see this groove. This groove is called subclavian groove or subclavian groove because this groove is attachment for subclavian muscle. The subclavian muscle attached to this groove. Okay? Lateral end, you can see conoid tubercle and trapezoid line. Conoid tubercle and trapezoid line. Conoid part, and trapezoid part of the coracoid clavicular ligament attached here. The most powerful ligament of the shoulder is coracoid-clavicular ligament. Coracoid-clavicular ligament has two parts, conoid part, trapezoid. Two-thirds medially of clavicle is convex. Two-thirds medially of clavicle is convex. One-third laterally is concave. Two-thirds medially is convex. One-third laterally is concave. The border between two-thirds medially and one-third laterally here is common site for fracture. Fracture of the shoulder, fracture of the clavicle is here. The border between convexity and concavity. Okay? The clavicle is the first bone leading to ossification, and is the last bone. That's the ossification is complete. Okay? The start of ossification is into the clavicle. Complete of ossification of bones of the body is clavicle. Clavicle is important because some muscle attached to it. For example, anteriorly, this muscle, pectoralis major, and this muscle, deltoid, pectoralis major, deltoid, attached to clavicle. Okay? Pectoralis major and deltoid attached to clavicle. Superiorly, this muscle, what is this? Sternocleido. Cleido is meaning clavicle. Sternocleido, mastoid. And this muscle? Trapezius. Attached to clavicle. Sternocleidomastoid and trapezius attached to clavicle. For this method is very important for transmission of weight from the upper limb to axial scale. Axial scale. Scapula. Scapula. Come. Excuse. Your body is very good. Okay. What's there? The scapula. Okay? The scapula. Cover posteriorly. Second to 7 ribs. The scapula cover posteriorly. Second to 7 ribs. This one. This one is spinal scapula. Spinal scapula is at the level of the third thoracic vertebra. Third thoracic vertebra. Okay? You can touch medial border, this one, inferior angle, and what is this? Spine, spinal scapula. When I follow the spine laterally, you can touch this structure. What is this? Acromion process. Fourth part of the scapula is touchable. Medial border, inferior angle, spine, and acromion process. In this figure, you can see anterior surface of the scapula. Anterior surface of the scapula. You can see this surface, anterior surface, is called subscapular fossa because subscapular is attached here. Okay? This surface is called subscapular fossa because subscapular is considered attached here. Superior border is very important. Superior border is very important. Superior border of the scapula superior border of the scapula here is very important because you can see a notch. Oh, this notch is called suprascapular notch because it's superior border, suprascapular notch. The suprascapular notch is changed to foramen by a transverse ligament. Okay? It's called suprascapular foramen. Foramen is meaning opening. Foramen in anatomy is called opening. Okay? Which structure pass through suprascapular opening? Suprascapular nerve. In all of the world, the only area that the river has over reach is here. Okay? This ligament is a bridge. This artery is a river. The river has over reach, no under reach. Okay? So, suprascapular foramen contains suprascapular nerve. This nerve innervates this muscle. What is this muscle? Supraspinatus. This nerve has this notch and enter this area. Which muscle is here? Infraspinatus. So, suprascapular nerve innervates supraspinatus and infraspinatus muscle. Okay? Lateral to notch. Lateral to notch, you can see this process. This process. Coracoid process. Can I touch coracoid process? Yes. My finger under the clavicle, middle clavicle, okay? Shoulder flexion produce a depression here, okay? This depression is between pectoralis and deltoid. For this is called pectoral groove. or infraclavicular fossa. This depression is location for attachment of coracoid process. Coracoid process is on the clavicle, between deltoid and pectoralis major. Between is on the clavicle, between attachment of trapezius, attachment of deltoid and pectoralis major. Coracoid process is very important because three muscles attach it. Three muscles are pectoralis, minor, short head of biceps, and coracobrachialis muscle. Coracobrachialis muscle. Okay? And the most powerful ligament of the shoulder arises from it. What is this? Coracoclavicular ligament. Coracoclavicular ligament. Okay. Lateral border of the scapula has not a special area, but lateral angle has a depression. Lateral angle has a depression. It's called Glenn cavity. Glenn cavity. For articulation by humerus and forms which joint? Glenohumeral joint. Glenohumeral joint. Okay. This one is spinal scapula. Spinal scapula. When followed laterally, this one is changed to acromion process. Acromion process forms tip of the shoulder. Tip of the shoulder is acromion process. This one is a common site for pain of the shoulder because tendon of this muscle, which muscle? Supraspinal, just below acromion process, and spatial structures between tendon of bone. Which structure? Between tendon of supraspinatus and this bone. What's this structure? Bursa. Name of bursa is subacromial bursa or supraspinatus bursa. For this reason, this area is painful. The acromion process is important because for tip of shoulder is a site, is a common site for shoulder painful. This pain produced by inflammation of subacromial or supraspinatus bursa, back of the sterols between acromion and tendon of the supraspinatus muscle. In this figure, you can see attachment of the coracoid process, three muscle and one tendon. This area is scapular fossa because right scapular is muscle. Okay. Posteriorly, we can see spinal scapula, above it, supraspinatus, below it, infraspinatus, rise from it. There is a notch between acromion and glenoid, between spine and glenoid. This notch is passage of suprascapular nerve. This notch is called a spinal glenoid or glenospinal notch. Okay? In this figure, you can see foramen is location for passage of suprascapular nerve. This nerve narrates supraspinal muscle, pass through this notch. This notch is between spine and delivery. For this is called spinal notch, and enter into the infraspinal muscle. Humerus is a long bone of the upper limb and four bone skeleton of the arm. Other name of the humerus is brachium. For this is some muscle is called brachium. Brachialis, biceps brachii. Okay? All of them rise from brachium. Humerus has a proximal. Humerus has a proximal end, distal end, and a body or shaft. Some look right body, some shaft. Okay? Upper part or upper end, you can see head, anatomical neck, greater and lesser tuberosity, shaft of the humerus. Okay? Head, articulate tube, glenoid, okay, is bounded by anatomical neck. You can see greater and lesser tubercle. When you stand anatomical position, okay, this one is tip of the shoulder is formed by acromion. Below it, you can touch greater tubercle. Okay? Anteriorly, you can touch lesser tubercle. Greater is lateral, lesser is anterior. Okay? Below greater and lesser, you can see spatial area. This one is a spatial area. It's called surgical neck. Because anterior and posterior, circumference arteries and this nerve, this one is called axillary nerve. Is related to, okay, two arteries, anterior and posterior circumference, humeral artery, and one nerve, axillary nerve, are related to surgical nerve. For this area very important. Surgical nerve. Between greater and lesser tubercle or tuberosity, there is this one. There is a groove. This groove is between greater and lesser. For this is called intertubercular groove. Other name is bicipital groove, because long head of biceps pass through it. This area is very important because Two muscles attached here. Longitudinal bicep has to be no attached. Three muscles attached here. What is three muscle? Intertubercular groove. This area is large. Intertubercular groove. This one is lateral. This one is medial. Okay. One muscle attached to lateral border is called pectoralis major. One muscle attached to medial border is called teres major. Pectoralis major, teres major. One muscle attached, deep, attached to fluid of the groove. This muscle is called latissimus dorsi. Okay? Two muscles attached to bicipital groove or intertubercular groove. Lateral border, pectoralis major. Medial border, teres major. Fluid of the groove, latissimus dorsi. For memorize, I can use this formula. A lady's latissimus dorsi is between two majors. A lady between two majors. Lady latissimus dorsi. Major, pectoralis major, teres major. Okay? Shaft or body. Shaft or body of the humerus. In lateral surface, in midpoint of the lateral surface, in midpoint of lateral faces, contain tuberosity for attachment of. What is this? Deltoid muscle. For this thing is called deltoid tuberosity. Deltoid tuberosity. In midpoint of lateral surface of the shaft, there is a tuberosity. It's called deltoid tuberosity. In midpoint of medial surface, there is a shaft. There is a tuberosity for attachment of. This one is coracoid process. This one is brachium. Which muscle attached here? Coracobrachialis. So, body or shaft of the humerus, in lateral surface contain tuberosity for deltoid muscle. It's called deltoid tuberosity. In medial surface contain tuberosity for coracobrachialis muscle. Posterior surface of the shaft. Posterior surface of the shaft. Why we use a spotlight? For showing the posterior surface. Posterior surface of the shaft has a groove. This groove is called radial groove. This groove is called radial groove because contain radial nerve and deep brachial arch. Okay? This one is anteriorly. One head. Anatomical name. Greater, lesser, towards this one. Intertubercular groove. Other name. Bicipital groove. This one. Surgical neck. Surgical neck is related to anterior and posterior circumflex humeral artery and axillary nerve. Body, midpoint of lateral surface, deltoid tuberosity, medial surface, coracobrachial attachment, posterior surface. medial to lateral. From medial to lateral, you can see radial groove contain radial nerve and deep brachial. Because this bone is called brachial. For this reason, this artery is called brachial. Deep brachial artery. Lower end. Lower end of the wings. As a whole is called condyle. As a whole is called condyle. Divided to medial and lateral condyle. Medial and lateral condyle. Medial condyle is prominent, is more prominent. Lateral is not. Medial condyle, touch. Medial condyle is most prominent. Lateral not. Medial condyle is most prominent because this one, okay? Because a nerve is behind it. Medial condyle is prominent for protection of the nerve. This nerve is called ulnar nerve. I move ulnar nerve. Okay? This one is ulnar nerve. Which part of your body is sense? Painful.
Painful one?
Yes. Little finger or tongue.
Little finger.
Little finger. Because ulnar nerve innervates little finger. Okay?
And sometimes when we crush it
Yes.
with the little things,
Yes.
we feel electricity.
Lower end of the humerus is called condyle. Condyle is divided to medial and lateral condyle. Medial condyle is prominent for protection of ulnar nerve because ulnar nerve has behind it. Okay? Anterior surface of condyle or anterior surface of the lower part of the humerus, you can see this structure is like a trochlear. It's like a trochlear. For this one is called trochlear. Trochlear notch or trochlear. Okay? Lateral to it, you can see this prominent area is called capitulum. Lower end of the humerus. Lower end of the humerus has a medial epicondyle is more prominent. Medial epicondyle is more prominent. Lateral to it, you can see a trochlear, and lateral to it, you can see a process. This part is called capitulum. Capitulum. Okay? Above trochlear, you can see a depression. You can see depression. Above capitulum, you can see depression. Depression above trochlear is called coronary fossa. Depression above capitulum is called radial fossa. Okay? Radial fossa. Posteriorly. Okay. Anteriorly from middle to lateral, medial epicondyle, trochlear, capitulum, lateral epicondyle. Medial is more prominent for protection of ulnar nerve pass behind the medial epicondyle. Posterior surface, Above thoracic, you can see this depression. Coronary fossa. Above capitulum, you can see this depression. Radial fossa. Posteriorly, you cannot see capitulum. You cannot see capitulum, but you can see trochlea. Above trochlea, posteriorly, you can see a deep fossa. It's called olecranon fossa. Olecranon fossa. I ask you, which part of the humerus can touch it? Which of humerus can touch it? One, lesser tubercle, greater tubercle. In lower part, medial epicondyle. Okay? We can touch three part of humerus. Medial epicondyle, lesser and greater tubercle. Other part covered by muscles. Posteriorly biceps, anteriorly biceps. Okay? In this figure, you can see again, this one is anterior surface. Okay? This one anterior surface. Okay? Why? Because I can see capitulum. Capitulum can be seen anterior surface. This one is anterior surface. From medial to lateral, medial epicondyle, trochlea, capitulum. Above trochlea, coronary fossa, above radial fossa. Posteriorly, you can see trochlea, above it, olecranon fossa. Which first plate of humerus is ossified early? Early. Proximal or distal? Distal. Because then I see on the shoulder. Okay. Blood flow or water flow is toward elbow. For this area is ossified early. Body of the, humerus is most important bone because relate three nerves. Surgical nerve relate to axillary nerve. Body or shaft, radial nerve. Medial epicondyle, all of them. It is important. All of them are posterior to the muscle. Posterior to the muscle, behind, posterior to the bone, behind of the bone, behind of the surgical neck, behind of the body, behind of the medial epicondyle. I have to memorize one surgical neck is fracture. Which nerve is injured? Axillary. Axillary nerve in a way, this muscle. What is this muscle? Deltoid. For this muscle is atrophy, is small. Okay? Radial nerve in a way, this muscle. What is this muscle? Triceps. Ulnar nerve is injured when medial epicondyle is fractured. Okay? So this is some muscles are innervated by ulnar nerve or paralysis. Which finger is senseless? Which finger? Little finger. Okay? In this figure, you can see this one is expert. This one is fracture of sacral. This one fracture of body of the humerus. Okay? Body of the humerus. This one is fracture of the lower end of the humerus. In this area, which nerve is injured? Ulnar. Radial nerve. Okay? Finish.